Welcome to Aging Gracefully on Suncoast FYI. Each week we talk to different experts and professionals on a wide range of subjects to give you tips and advice on living a happy and healthier life, no matter what age you may be. This week on Aging Gracefully, we talk to Alicia Couri, Dr. Russell Samson, and Matchmaker Mimi Lee. Author Alicia Couri returns this week to talk about how your smile can make you feel and look younger. Well, I know yours does.
Yeah.
Okay.
Yes.
But how do we get that smile that Sandra Bullock and Julia Roberts have? I mean, they are just the epitome of a smile.
Yes, they have the widest and brightest smiles out there. And you know, the thing is, it's about showing teeth and really lighting up from the inside. And so really and truly, a smile not only makes you feel good, but it also helps you look younger.
Because you're getting rid of all of those tiny wrinkles around your mouth.
But you know, you get them around your eyes, but that's okay because you know, when they appear around the eyes, actually, people don't know if they're just smile lines or if they're really wrinkles. So you get away with that.
Okay, so yeah, there's toss-ups, but I agree, smiling does make you feel better.
It makes you feel so much better.
Does,
yes.
It does. Other than making you look younger, what else does it do to promote your, like you said, your inner health and make you feel better?
Well, first of all, it does make you look younger. A lot of, there was a report done on psychology and aging that they tested 152 people, I think. They brought them in and they showed them over 2,000 photographs of people with various expressions. From smiling, they were angry, they were neutral faced, they were like sad, disappointed, a lot of different facial expressions. And one of the things that came out of that report was that those who were smiling, their age was actually determined on average at least 2 years younger. A lot of them could be a lot more. Right. So it is actually, you know, there was a report done that shows that smiling does make you look younger.
And I think it helps other people too. When they see you smile,
they smile.
They smile.
They can't help but smile back at you.
Right. So it's
exactly
contagious. Now, you know, a lot of people are self-conscious about smiling because of the condition of their teeth.
Yes.
And not all people can afford to take care of their teeth as they should,
right?
Especially as they get a little bit older. What can you suggest that they do as far as their aging and confidence and everything gets tied into their smile and how their teeth look?
I have experience with that too, because when I was younger, I did not like my smile at all. But as far as taking care of your teeth, there are things that you can do that, you know, maintenance. So oil pulling, that's something that you can do.
Yes.
Coconut oil, oil pulling, it detoxifies.
My daughter does
she does that,
yes,
right?
She does.
So it detoxifies the mouth, it helps whiten your teeth, and you know, it really promotes better health because your teeth, the health of your teeth and gums is directly linked to your own health, your heart health. And so you want to take care of those things. Another thing you can do, there's charcoal that you can use. There's
what form does it come in?
It comes in a powdered form. It's messy.
Okay.
But you use it with a toothbrush.
Yep.
And you brush your teeth with charcoal. It's specifically for teeth whitening.
Okay.
And it can help whiten your teeth.
Okay.
And you can use over-the-counter toothpastes to help take care of your teeth. But flossing regularly, you need to floss regularly.
You do.
Because when you are missing teeth or when your teeth are discolored, it really does affect your confidence. It affects your confidence on so many levels because you don't want to smile.
Right.
You know, when you have issues with your teeth, and people smile without teeth, and that's not it does not make you look younger.
No, that doesn't make you look younger.
It makes you look very self-conscious.
But if you take care of them like the rest of your body, I mean,
yes.
It's all kind of integrated into one.
It's all connected.
But the coconut oil pulling is quite very easy. You just put it in your mouth and swish it around.
Right, you put a tablespoon of coconut oil in your mouth and you
really
swish it for about 5 minutes, and yeah, it helps to detoxify.
So your challenges, you were saying you didn't like your smile.
Yes. Well,
I
you know,
can't
I'm
imagine
a
it's
petite
changed that
person.
much, but
It has changed a lot, but you know, I'm petite. So when
Yes.
my adult teeth came in, I had such a tiny little head that I thought my
Oh.
teeth were like. My teeth were enormous. And not only that, when I was about 6, I fell and I broke my front tooth.
Oh dear.
And when you have a broken tooth, it's a little
yeah.
spirit breaking tooth, you know,
Yeah.
because you don't want to smile and show a broken tooth. So I had to have that fixed. And so I was always self-conscious about my smile because of my broken tooth. And then finally, you know, I got adult sized.
Yeah.
Well, I'm still not
You
quite
grew
adult
into your
sized,
teeth?
but I grew into my teeth. So, yes, but when you smile and you show as much teeth as possible, that like lights you up from inside,
does,
and
yeah.
and it really makes everyone around you feel
good.
better.
Yep.
Yes.
Yep. So how can we protect our smile? I mean, you've told us some of the ways that, you know, with the oil and the charcoal. Anything else that you personally recommend?
Well, going to your dentist regularly, you know, going to see the dentist regularly, getting cleanings regularly, making sure that, you know, you don't have cavities that go. There are so many people that they don't want to know, you know, they don't want to know.
Yeah.
Another thing that you have to be careful about, the sugars that you eat, you know, watching your diet, because if you're eating too much sugar, again, that can destroy your teeth. So make sure you take care of that.
Wines, coffees.
Wine, staining your teeth.
Brush
Yep.
your teeth right after, or at least rinse your mouth out.
At least rinse it out. Exactly.
Okay.
Yes. Those are simple things that you can do. Everybody can do that. You know, rinsing it out after you had coffee or tea or wine.
Yep. How about people with teeth sensitivities?
Well, I have, my teeth are very sensitive.
Okay.
So you don't want to use white strips. You don't want to use over-the-counter things to help whiten your teeth. It's better to go to a professional and get it done if you have sensitive teeth.
Okay.
And you know, there's so many products out there now for sensitive teeth that also help whiten gently. So Sensodyne toothpaste, that's what I use, that has a gentle whitener. So you can try those things.
And the other thing is, a lot of people may not know how to smile, as odd as that sounds.
No, it's not that odd, because it's true. Some people just don't know how to smile. And you know, if you think as a child, children don't have a problem smiling. So if you think of a really happy memory and just allow that joy to flow up inside of you, because then you get a twinkle in your eye, you know, and then the corners of your mouth actually turn up. And then be brave enough to open it up and let the smile, you know, shine through.
Even if you're home alone, start there, right?
Start there.
Easy.
Just think of a happy memory. Just start right there.
Well, on that happy note, we'll end. Thank you.
You're welcome.
Please stay tuned. Aging Gracefully on Suncoast FYI will return after a short break. Our next guest is Southwest Florida's top matchmaker, Mimi Lee, here today to help navigate dating gracefully as we age. I have been so looking forward to meeting you.
Aw,
I really have.
thank you.
I've seen your beautiful advertisements in our
Yes.
local magazines.
Yes, indeed.
And I thought, you know, I would love to meet this woman and have her on the show. So thank you.
Well, thank you
Thank
very
you.
much for inviting me on the show. I'm excited to be here.
So let's start.
Okay.
Can you share with our viewers how you chose to do this? And you've been doing it about 25 years, right? Well, I know you don't
Yes.
look that old.
That's quite all right. I have a lot of experience, which is good. However, I was recruited by a lady named Patty Stanger. And for those who might know who she is, she did the Millionaires Matchmaker on Bravo years ago.
yes.
And so I met her many, many years ago.
Okay.
And she brought me along and recruited me, and I learned a lot from her, and I got the bug. I just had passion. I just felt like I finally have a voice, and and this is it. This is what I need to do and what I want to do. Yeah.
Well, when we were chatting and you said you're married and you've been married for 17 years.
Yes.
And you did meet your husband.
Well, through matchmaking.
matchmaking,
Absolutely. I
right?
would never have met him if I was not a matchmaker. Let's put it that way.
So that probably prompted you to say, you know, if it could happen to me, it could happen to anybody else.
Exactly. I
Okay.
can give assurance that
All
hey,
right.
I know for a fact you can meet someone wonderful and lovely and safe.
Well, Safe, yes. Okay. Now, I know there's a science somewhat to love. I mean, love is obviously not a classic science in the term of science, but what do you mean by the science of love and meeting somebody safe? I mean,
yeah, well, meeting safe is the major deal, and I can certainly help you with that. But going back to the science of things, it's been proven that people live longer if you're with a person or a second person, a companion or a marriage. And so I have noticed throughout my years of doing this, the people that I come in to see me, they look very young and vivacious, even though they may have been married for 40 years, they look great, and maybe something has happened and they're widowed at this point, but they're really young and spirited. And I believe it's because they were together with somebody for all that time, and now they look to replenish that and have a companion in their life.
It's always nice to share with someone. It is always nice to share with someone. So the being safe, we're going to talk about that a little bit later in the show. Okay.
Certainly.
But now, so the next step is, you know, when you meet someone, you know, I know you've had a lot of different people that you've joined together, and achievements that you're proud of.
So many.
How about we talk about one of those? So give us an idea so our viewers know what it's like.
Okay, I have a really lovely story about a lady and a gentleman, obviously. I had set them up on their first date, and unfortunately, on the way to the meeting, the lady, her friend, went into labor. So yes, so she had to cancel at the last minute on the date, and so that was a little disappointing and nerve-wracking. And so then I set up a second date, and it was raining. I was keeping my fingers crossed, but sure enough, they both made it to the restaurant. They got to meet each other, and then they spent time. And she had a beautiful necklace on that was an elephant, and he made a comment about it and said, "You look lovely, and what's the elephant for?" And she said, "Oh, the elephant is my favorite animal of all." And he said, "Really, why is that?" "Well, because an elephant never forgets." And so he took that in the back of his mind, and they ended up dating for a year. And then he reached out to me to let me know that he was getting engaged to her. And he was really smart. He went to a zoo that had elephants, and this was about 2 hours away from their home. And so they took a vacation, you know, a weekend vacation, and they went to the zoo. There's the elephant. He brought a photographer along so that he could watch. And what they did is he took pictures of them on the elephant, walking around, and she was just so thrilled. But most importantly, when he got off the elephant, he had the elephant bent down, and he bent down on one knee, and the elephant extended his trunk he extended the ring and asked him to marry
I have goosebumps.
Oh my gosh, and she was like, she couldn't believe it. And he had the moment, and because he had the photographer, she'll always remember the moment when he asked her to marry her because of the elephant. Isn't that a nice story?
That's very nice.
Yeah, I know, I got goosebumps too.
Now, for single men, women out there wanting to date, what's it like hiring a matchmaker? What are some exciting moments that they're going to experience when they meet with you?
Well, the excitement about it is the fact that my experience, I've been doing this for so long, and I'm very confident in the type of clientele that I have. Many people come in and think, well, I think I'm the only one that's doing this. And I say, no, I have many people just like you. They may be a male, they may be a female, but they're just like you, and they are comfortable coming in and meeting. It's just they're at a place in life where they don't know where to go. They don't want to go to a bar. That's old-fashioned. And so it's just exciting to be able to have my intuition direct and keep you safe. And that's where a lot of it comes into.
And that's it. I mean, you meet so many people, and you do have to be intuitive, because you wouldn't be in business for 25 years if you've been matching the wrong people up, right? So you meet them, and so your track record speaks very well of you. We're almost done, but I want to ask you one final question.
Sure.
Tip for the week. Any tips for the week for any age group that you have in mind? And Something you want to share?
Well, I believe there's love for everybody, so
It doesn't matter what age.
It doesn't matter what
Okay.
age. I believe wholeheartedly it does not matter. And the tip would be to be positive, have a positive attitude, and when you do meet someone new, stick to the positive things. Don't talk about the past. Let's focus on what's going on now, and let's talk about your passions now. So keep positive and keep a smile on your face, and you'll make it work.
Okay, great. Well, thank you. I look forward to seeing you next time.
Well, thank you very much for having me on the show. Thank you.
Thank you for tuning in to Aging Gracefully on Suncoast FYI. We'll return right after the break. Returning this week is Dr. Russell Samson to talk about peripheral arterial disease, or better known as PAD. Welcome back, Doctor.
Thank you for having me.
Absolutely, absolutely. So what is PAD? I know you said a lot of your patients recognize that more than the long term.
Right, PAD,
Yes.
or peripheral arterial disease. So people know about coronary artery disease, where they have blockages in the arteries to the heart. But that's just one manifestation of blockages that can occur anywhere in your body. Very common in the heart and causes heart attack.
Okay.
But I think a lot of people now realize that you can get it elsewhere in the body. And the main area that you can get it is in the arteries to the legs.
All
And
right.
since the legs are far away from the heart, that's why we call it peripheral.
Okay.
And arterial because it affects the arteries, not the veins.
Okay.
And it's blockages in the arteries to the legs.
And what causes that?
Same type of thing that causes blockage in the heart arteries. It's called atherosclerosis, or fatty deposits. People know plaque that develops. And so, why you get it, it's a buildup of cholesterol, calcium, fats that starts to develop in your body, usually related to smoking or diabetes or just bad diet.
Yeah, okay.
And ultimately, when you get it in the legs, it can cause symptoms. And the usual symptoms that people get in the legs are difficulty walking. Patients will tell me that they can walk about 100 yards or so, and then their legs start to become uncomfortable and heavy. And they feel like they have to stop, and as soon as they stop, the pain goes away, and then 2 or 3 minutes they can start walking again. And there's a medical term for that. We call it claudication. But really, it's just pain with walking that goes away when you stop and comes back when you start again.
So pain, like shooting pains, or is it like you said, a heaviness? I mean, that's
Yeah, those are good questions. No, it's not a shooting pain. It's usually in the calf muscles.
calf muscles.
Can sometimes
Okay.
be in the buttocks.
Okay.
And it's a heavy aching thing. I'm sure everybody's had an experience when you've gone for a very long walk, or you've climbed up a flight of stairs and your legs just feel tired and achy.
Right.
That's the type of pain that they have. But sometimes it's been quite severe. Sometimes people really, the pain can develop so strongly that they really feel an intense pain.
Okay. And how is something like that diagnosed? Other than, I mean, obviously, if you have the pain, but can it go undiagnosed?
It does. The majority of people who have PAD don't know that they have it, because they can have narrowings and blockages, but they don't walk far enough to get the discomfort, or the blockages aren't bad enough to cause the discomfort. So what we recommend for people that are at risk, and we can talk who those people are, but there's a very simple test where we take the blood pressure in the ankle. And if you've got a blockage in the circulation down to your lower leg, then the blood pressure will be low in the ankle. And we use a device called a Doppler. It's a little sound device like a stethoscope.
Okay, so it's
Very
not
simple.
painful. It's a simple.
Very simple test, takes
Okay.
5 minutes.
All right.
And that'll tell you whether you have it or not.
Okay. And how is it treated? Once you find out, what is the treatment for it?
Well, the majority of people, we just tell them to exercise and try and get into a walking program and improve their endurance.
Okay.
But we like to
So-
get rid of the risk factors, which I think is something we'll talk about at a different segment.
Okay.
But there are treatments for this. They can be as simple as what we call a balloon angioplasty or a stent.
Which is something you also do on the
In the
heart. So
heart,
there's
so
same kind of
Same type
kind
of thing, except
treatments?
we do it in the legs.
Now, are they, because we think of the heart as being a much more risky part of the body to treat. So are there as many risks? Are there less risks to something when you're treating the lower part of your body like that, your lower extremities?
Anytime a doctor touches you, there's a risk.
Of course.
But the risks are less than when you have it in the heart. But it has to be done by a specialist.
Yes.
And the usual specialists are vascular surgeons, because Sometimes you can't do a balloon procedure, and then you actually have to replace the artery. So just like someone has a replacement in an artery in the heart, we do replacements of arteries in the legs, and that's called a bypass operation. Not a heart bypass, but a bypass in the leg.
Okay. And you get those from other parts of the body?
We do. We take the patient's own vein that's in the leg, we turn it around and use it as an artificial artery. And if that patient doesn't have a good enough vein or it's been used somewhere else, we do have plastic tubes that we can sew in that we can use as those bypasses. So there are many things that we can do, but we try to do the least possible.
Okay, and again, you know, we were talking about doctors that are qualified to treat PAD.
Correct.
You have to be careful about who you go to see.
Your family doctor,
well?
your family doctor can usually make the diagnosis and can do most of the kind of conservative treatments, exercise, diet, etc. But once you need an intervention, such as a balloon procedure or a stent, we even have lasers, all sorts of things that we can use, or a bypass, then that's done by people called vascular surgeons.
Okay.
So they're trained not only to do surgery, but can do the medical management and the balloons and other things.
All right. Now, depending on how severe the PAD is, you recommend different types of procedures.
Correct.
Like when do you use a laser as opposed to doing, you know,
well,
a stint
that's
or
a
something?
secret. I'm not going to tell you.
Oh, you have to have it come and done?
But what we do is we have simple ultrasound tests that give us a good idea what treatment we're going to do. And then we may do what's called an angiogram, where we put dye into the blood vessels. And then the doctor makes a determination what type of treatment will be done.
Okay. All right. Tell us again where we can find you.
Sarasota Vascular Specialists, that's just off Cattleman Road or Fruitville Road. And you can go to veinsandarteries.com and you will find us.
Great. Thank you. We'll see you again.
Look forward to it.
Thank you for tuning in to Aging Gracefully on Suncoast FYI. To find previous episodes, go to snntv.com under programming. See you next Saturday and Sunday at noon.